Information is empowerment. And the change that information can bring in is intergenerational. And this intergenerational change is what I want to see throughout the world. Hi, I'm Dr. Aparna Hegde. I'm the founder of the NGO ARMMAN that leverages technology to create cost-effective, scalable solutions to impact maternal and child health in 21 states of India. In the next 1 hour, 3 women will die in childbirth somewhere in India. 2 children under age 5 die every minute in India. India's malnutrition rates are worsening. India has one of the highest under 5 mortality rates in the world. 2 primary reasons are, 1, lack of access to information, and on the other hand, the health workers at every level of the health system are not really aware of their part of the treatment process, how to identify the risk factors early, manage in time, before it's too late. Given the sheer scale of India's numbers, it was very important that any solution I designed had to be scalable, accessible to every woman in her home, and yet cost-effective. Technology allows that. Our programs have 2 arms. On the beneficiary side, directly to the women, we have a program called Khilkari in collaboration with Government of India, which is the largest such mobile health messaging program in the world. Khilkari currently reaches 47 million women in 21 states of the country, and hopefully in the next 3 years will reach 70 million women pan-India. On the other hand, we have our programs for training of health workers at every level of the health system. We have our program called Mobile Academy in collaboration with the Government of India, which has reached around 371,000 health ASHA workers, that is the frontline health workers, and we hope to reach 850,000 ASHAs pan-India in the next 3 to 5 years. Then we have the program called Integrated High-Risk Pregnancy Management and Tracking Program for the nurses, medical officers, and specialists. Going forward, we'll be tracking the pregnant woman with high-risk factors end-to-end. So if a woman becomes pregnant, she becomes a part of the database. If she's got a high-risk factor, it's tracked. So it leads to dashboards at every level. Now, what does this mean for the individual mother and her journey through the health system during her pregnancy and her child's infancy? Imagine Aruna in rural tribal India. She gets pregnant and the ASHA worker pays her a home visit. And when she's getting registered into the database of the Government of India through the ASHA informs her that there's a program called Khilkari that will come to her weekly in her phone with important critical information of how to take care of herself and her child in that particular week. She might get voice calls if she got a feature phone, but if she got a smartphone, she'll get multimedia content, live action videos. She can even ask questions. It'll handhold her through pregnancy and infancy. So she will know exactly what are the risk factors, what are the danger signs, what are the complications, why she needs to access regular care, what medication to take, but also handhold her emotionally, tell her how the baby is growing in her womb, when her child develops fingers. So it's like a companion for her through pregnancy and infancy, answering all the questions she needs. Similarly, when the ASHA is trained on how to take care of the mother at the same time, if a woman has a problem, a risk factor, and when she approaches the ASHA will actually know what to do in that situation. She will take the woman to the nurse. Now, the nurse medical officer specialist is also trained now because they know exactly what is their role in each high-risk factor. And this would mean that she would have a healthy outcome, both for herself and her child. I want every child to be nourished enough to have the cognitive ability to grow up to be a healthy adult and contribute to the country and the world at large.